Be ready.
Okay. So you all know when you're insecure, everybody's insecure, at least one point in their life. Well, that's where it falls for me. I've been insecure about my weight and my body image since I was about 6, maybe younger. I've been picked on my entire life, but I always just seem to ignore it, but it never goes away. By the age of 8, I was diagnosed with BED, or binge eating disorder. That went on for a couple years, it still does, and by the age of 12, I had grown so insecure about myself, I developed bulimia. That has always been a struggle in my life, but I always seem to get through it somehow. So today, I'm here to talk to you about eating disorders and why it's important to actually know what they are. First, we're going to start out with anorexia nervosa. It's one of the most common, well, not really common, but most widely known eating disorders because of how it alters a person's appearance. Anorexia nervosa is the cycle of self-starvation. Usually a person has an absolute fear of this disorder, and they cannot even eat sometimes. Physical signs include severe muscle loss, thinning of hair, brittle nails, extreme sensitivity to cold, dry skin, and for female patients, usually a loss or complete stop of menstrual cycles. The results include a slowing metabolism, irregular heartbeat, dizziness, lack of physical strength, chronic fatigue, kidney or thyroid problems, as well as many other problems. It is not something you want to live with. Facts that are really not commonly known include the fact that 1 in 10 sufferers die. There is a high incidence of suicide among anorexia nervosa sufferers. This is due to their increased, well, I guess if I were to say it, their increased loss of self-confidence. They don't have any. Anorexia nervosa can start as a patient's young teenage years. Between 85 to 90% of sufferers, it is female. The mortality rate of anorexia nervosa is 12 times higher than the average of any other cause of death. Now we're going to move on to binge eating disorder, or BED. BED is the recurrent episodes of eating large quantities of food, often very quickly, and to the point of discomfort. People with BED tend to gain weight, and due to this have health consequences such as high blood pressure, high cholesterol levels, heart disease, type 2 diabetes, and often gallbladder disease. Usually with people that have BED, they have psychological problems as well, such as anxiety, depression, and personality disorders. For me, that would be anxiety and depression at the same time. Binge eating disorder is the most commonly known eating disorder in the U.S. Facts of binge eating disorders. Binge eaters often feel shame and anxiety when eating in front of others. This causes them to eat less than they would in order to feel normal, per se. People with binge eating disorder tend to partake in dietary restriction or fasting, but due to their binge eating disorder, they always end up going back to old habits. You do not have to be overweight to have binge eating disorder. Binge eating disorder affects 3.5% of women, 2% of men, and 1.6% of adolescents. Binge eating disorder tends to begin in late teens or early adulthood. Bulimia nervosa. A mental disorder marked by binging, followed by methods to avoid gaining weight or purging. This can involve using laxatives, vomiting, or even excessive exercise to the point of collapsing. Bulimia nervosa can affect the entire digestive system and lead to electrolyte and chemical imbalances in the body that can affect the heart and other major organ functions. Health consequences include irregular heartbeats, dehydration, gastric rupture, inflammation, and rupture of the esophagus, tooth decay, and staining. peptic ulcers, and pancreatitis. Facts of bulimia nervosa. Bulimia nervosa affects 1 to 2% of adolescents and young women. Approximately 80% of bulimia nervosa patients are female. People struggling with bulimia nervosa usually appear to have the average body weight. Frequently associated with symptoms of depression and changes in social adjustment. Some scientists believe that actually bulimia nervosa is maybe genetic. Facts about eating disorders alone. Eating disorders are not a phase, not a fad, and not a lifestyle. They are not something you want to live with. They're not something you want to diagnose yourself with. Because of this, you can potentially end up killing yourself or maybe dying because of all the health consequences. Of American schoolgirls who read magazines, 96% say that the pictures influence their concept of an ideal body shape. 47% say the pictures make them want to lose weight. These are schoolgirls, about 6 to 12. In the US alone, 20 million women and 10 million men suffered from eating disorders. By the age of 6, girls especially start to express concerns about their own body weight or shape. 40 to 60% of elementary school girls ages 6 to 12 are concerned about their weight or becoming too fat. Question here, does being thin really matter? Does it? Does being thin matter so much to you that you would develop an eating disorder and potentially kill yourself in the process, losing all self-confidence you have? I want you to answer this.
Cool. Well done. Well done.